The coming weeks will continue to pose real challenges, especially to our hospitals. But these are challenges our hospital system can manage. We can be confident in our ability to care for people, to provide hospital beds to those who need them. And we can be confident that the worst is behind us as we look to cautiously ease public health measures.
By March 14th, we intend to lift capacity limits in all indoor public settings and religious services and ceremonies, and increasing social gathering limits to 50 people indoors with no limits outdoors. Proof of vaccination requirements will be maintained. Final recommendations on moving to each step will continue to be based on the recommendations of the Chief Medical Officer of Health.
It is the news many Ontarians have been eagerly anticipating. The province announcing today it will be loosening COVID-19 restrictions at the end of this month. As of January 31st, restaurants, gyms, and movie theaters can reopen at half capacity. Facilities that allow spectators, like concert venues and sporting events, will also be capped at 50% or 500 people, whichever is less. The number of people allowed at social gatherings will also increase to 10 people indoors and 25 outside.
And pending any other concerning trends in the public health sector, the province will phase out remaining restrictions and capacity limits 21 days between each step, while maintaining proof of vaccination where required. And by March 14th, the province is planning to remove capacity limits for all outdoor gatherings. And with more reaction to the new public health measures, we're joined live by Dr. Peter Jüni, Scientific Director for the Ontario COVID-19 Science Advisory Table. We always appreciate your time. Thank you so much for joining us on CP24 tonight. So, Doctor, we heard that the peak of Omicron might not come until a couple weeks into February, and there's obviously some legitimate concerns about starting the reopening a couple weeks prior to that. And we heard Dr. Moore talk about some of those data points that led to this decision. I was wondering if you can highlight a little bit more about some of those data points that people would like to know, that what led to the reopening, the plan to gradually reopen the economy.
Look, we indeed have a challenge right now with our navigation, of course, but when we look at wastewater data and also right now look at the behavior of hospital occupancy, it seems as if we have had a peak already and that we just are at the high plateau now and just ride the wave. The point now is just that we don't have the necessary data to understand how this will look like in about 10 days. Why? There are two different options if it comes to hospital and ICUs now. We can stay at the level we are with hospital occupancy. That's relatively likely because we were flattening this wave. This means that there is not, a single peak and it goes down, but everything stays up a bit. Or there is a possibility that we will start to see a decrease in hospital occupancy, relatively soon a peak in ICU, and then also a slow decrease a little bit. So we will see where this goes, and we need more data. We also don't have data yet, of course, to see what the impact of schools are.
How big of a challenge is that, Dr. Jüni, that kids just went back to school yesterday, and despite not having long-standing data, we're seeing increases in pediatric patients in pediatric ICUs. But essentially, the province is taking a chance, hoping it's kind of plan B, as you're suggesting, that we're seeing that downward trajectory of hospitalizations in the next couple of weeks.
Yeah, we will need to see, I think we need to have an open mind now to look into what's happening during the next 10 days. And there's one thing that just everybody needs to understand. They need to get their third dose. This is tremendously important. That's one of the things that can make a difference relatively soon, already in February. A lot of people don't push enough. We need to get third doses into people's arms. That's one of the issues. The other issue is big question, how to keep restaurants, bars, gyms, etc. safe. What would make them safer, of course, is if we have a vaccine certificate that covers 3 doses as the requirement for a vaccine certificate, not just 2.
We know that we've heard from many of the health officials that the current case count is an undercount, specifically because we just don't have enough capacity to do all the testing that the province wants to right now. And I'm just curious, Doctor, when we talk about the metrics and we talk about those measurables and the data points, how concerned are you about, the upcoming gradual easing when we really don't have a clear picture of how many cases are out there, specifically because a lot of people just can't get those tests?
Oh, at any given point of the pandemic, we were undercounting. That's a fact, and that's a fact for everybody in the world. We undercounted probably, had about 2 out of 5 cases that found their way into the statistics. Now it may be just 1 out of 5 or perhaps 1 out of 7 cases. That's roughly what we're talking about. I would estimate, and this is just a ballpark, that the real number of infections happening daily is around perhaps 60,000 or so a day right now. That's just a ballpark, and we need to figure out better during the next 10 days, fill in blanks, how this will approximately look. The point really is that we need at least a week more data to understand where we're going right now. You're completely right with that part. And it won't be case count, so it will be test positivity, wastewater, the behavior of hospital beds occupied, behavior of ICU beds occupied.
Dr. Jüni, I want to go back to a point which you made about introducing third dose as part of this proof of vaccination in places like restaurants, gyms, where proof of vaccination is required. The Premier said today he has no intention of doing that. Is that a mistake, and why? And how do you convince the public that that's necessary at this point in our battle with COVID-19?
Yeah, well, this is, again, evolution in real time, as I keep saying. Omicron evades the immune system. We know that now, and we learned it the hard time that this is indeed the case, meaning if you are about 8 weeks after the second dose of your vaccine, you will nearly be equally as likely to be infected as somebody who is not vaccinated. If you have a third dose, your risk of getting infected is reduced roughly by a factor of 5 times reduction, which is quite a lot. So if we would achieve a situation where we could have third doses as part of the requirement, this means we could keep a place like a restaurant much safer. That's just a fact. This doesn't go away. And of course, people will say, well, they moved the goalposts, etc. It's not it's the virus that has moved the goalpost.
And furthermore, when it comes to those third doses, we still have a large portion of the population in that 12 to 17-year-old category that have had 2 doses that are getting really close to that 6-month mark. And we've heard and we've been told that after that mark, the vaccine slowly starts to wane. With all the kids going back to school, I'm wondering what your thoughts are on also fast-tracking third doses for 12 to 17-year-olds.
So first of all, what is important, this wanes much earlier than 6 months. We know that after 3 months or so, but we don't know how it will be in 12 to 17-year-olds. Why? Adolescents and their children have a much more robust immune response, and they could have longer lasting immunity. We simply don't know. So from the perspective just of the risk of adolescents and all the children, the risk is luckily relatively low. And we know that can look at hospital statistics. The lowest risk of being hospitalized is actually in these age groups, which is good news. It then goes up a little bit now in those below the age of 5. So it's more of an issue just with infections per se, not with avoiding hospital admissions, etc. If we would expand vaccine certificates to 3 doses, of course, there would need to be an exemption for the 5 to 17-year-olds.
Dr. Jüni, I'm glad to hear a much more hopeful tone from you the last couple of days. The last time you and I spoke was back in December, and I won't forget it. You said you were really worried that we were heading on a trajectory towards triage. Are we past that point now?
Yes, and the point is the public reacted well. If we look at our dashboard, out-of-home mobility, they dramatically reduce their out-of-home mobility. That's associated with contacts by roughly 50%. before the New Year's Eve. That's amazing. And then we had the public health measures, and this really made a difference, a dramatic difference. You can just simply compare ourselves with New York and see how much of a difference we all made here. Now what is important is that we don't get ahead of ourselves and take it slow, and we just need to keep in mind this first step will be the most challenging one. Therefore, people need to get their third dose. That will help us tremendously during the next few weeks.
Here's hoping we're through the worst of it. Dr. Peter Jüni from the Science Advisory Table, really appreciate your time.
Thanks for having me.